Hello everyone and welcome to the Alaska AHEC Scholars Program Orientation. My name is Gloria Burnett and I am the Alaska AHEC Program Director, and I'm here to share with you a brief orientation of our AHEC Scholars Program. Since you all have been accepted to the AHEC Scholars Program, congratulations. We look forward to unfolding this program with you over the course of the next couple of years. As I said, welcome. Some of the things that we are going to be going over during this orientation are to improve your understanding of an overview of our program, what it's all about, why it came to be, and what we hope to gain, what are our goals, the program requirements, the program incentives, so what is the gain for you, what are you going to get out of being part of this program logistics, the ins and outs of the down and dirty, and then of course the evaluation and follow-up. So we'll be going through each of these areas of the orientation, and I will be giving you more information as we continue on. Program overview. So the Alaska AHEC is part of a national network of AHEC centers and programs throughout the entire country. We are a federally funded program through the Health Resources and Services Administration, HRSA, and our main focus is improving diversity and distribution of healthcare professionals throughout the country. Here in Alaska, that is ever so important, especially with the extreme difficulties we face in retention and turnover in our rural communities. And we also know that a lot of our training facilities for healthcare profession students are located in urban centers, like here in Anchorage and the programs that some of you are involved in, or in Fairbanks, where a lot of our programs are located as well. It is really difficult to entice a student to practice in a rural community upon graduation if they've never experienced that community. So part of our focus has always been providing students that are interested in rural healthcare with opportunities to practice and experience what rural healthcare looks like and feels like as part of their training in their health program of study. More recently, our federal funders of HRSA have really geared us all towards creating a new program where we will work more in a prescribed fashion with our students that are part of our program, and that program is slated the AHEC Scholars Program, and you all are part of that program for Alaska. Our priority, of course, for our program will be working with underrepresented students, and the reason for that is we want to increase diversity in our healthcare workforce throughout the state. So when we think about diversity and we think about underrepresented, the types of students that are involved with that category are those from ethnically diverse backgrounds, those who have a lower socioeconomic status, those who are educationally disadvantaged, which could mean that you are a first-generation college student, maybe the first person in your family to attend college, or you attended school in a rural community, which in and of itself can qualify as educationally disadvantaged, or you're from a rural community. That in and of itself is something that we're looking at as a priority. We want students from rural communities to take part in our program and then return to those communities upon graduation to practice. We also recognize in developing our program that not all students have the interest in serving in a rural location, but we know that there are plenty of underserved populations located in our urban centers of Fairbanks and Anchorage that could also benefit from a specific interest in serving those populations. In turn, we kind of have two options for our experiences, both rural locations and urban underserved populations in an urban center. And ultimately, what's the goal? We hope that all of you as AHEC scholars upon graduation will practice in either a rural community or with an underserved population. That is how we will measure whether or not we are successful in our implementation of our AHEC Scholars Program. So now we're going to start getting into the nitty-gritty of the program. As I mentioned, we did receive kind of a prescribed list of what components AHEC Scholars Programs must have throughout the entire nation. That's really what this slide is about. The program is a 2-year minimum. That means you can be part of the AHEC Scholars Program for more than 2 years, but at the very minimum, you must be an AHEC Scholar for 2 years. The program also requires 2 different types of experience. The first is community-based experiential learning. You must have 40 hours of community-based experiential learning hours per year, and that would be working with either that rural community or with an underserved population. In addition to the 40 hours of community learning, you must also have 40 hours of online or in-person coursework on core topic areas per year. That is your didactic requirement for the program. Now the questions, because I know there will be many of them. The first question that I tend to get a lot is, well, what qualifies as an underserved population? There are many different types of populations in our urban centers that would qualify, and different experiences that many of you might already be doing or have an interest in experiencing in your studies. The first is tribal facilities and tribal communities. Anything that has to do with tribal Alaska Native healthcare will be considered an underserved population that would count, regardless of if it's in a rural or an underserved urban community. Homeless populations, of course, are considered underserved. Domestic violence victims would be considered a population that could be worked with. HIV/AIDS patients are underserved. Elderly and palliative care placements, anything to do with substance abuse or mental health would be considered underserved. Health professional shortage areas or populations, this is something that we would be able to utilize the HRSA database and look up your zip code for the location that your rotation is going to be at or your experience, and we can determine whether or not that location is indeed a health professional shortage area or a health professional shortage population. In the same justice, there's also nurse shortage areas that we can look up to see whether or not they qualify through the HRSA database. Residents of public housing would be considered underserved. Rural health clinics and communities, overall, anything in a rural community would be totally acceptable as part of this program. And then finally, people with disabilities or chronic illnesses would be considered underserved populations. So as you can see, there's a lot that we can kind of be flexible with in terms of what your community experience looks like. The next question that I get a lot is, can I double count the hours of my community-based experience towards both the AHEC Scholars Program and my academic program? And the answer to this is yes. If you want to use your clinical hours that are required for your program as your AHEC Scholars community-based experience, this is fine, this is okay. But the only thing that we need to do in order to make sure that this is applicable is working directly as an AHEC program with the faculty within your academic program. And the reason for this is because faculty have a set of accreditation standards that they must apply to and they must abide by. And in a lot of cases, that includes a memorandum of agreement with their placement sites. There's certain types of preceptors that they're required to look for. AHEC doesn't have those same restrictions. So it's a lot more flexible if you're doing a rotation or an experience outside of your clinical requirements. However, if you want them to count, the only caveat is that we need to work closely with your faculty member to make sure that it is an approved placement site and preceptor. This will assure compliance for your program, and your faculty will feel a lot better about making sure those hours can count as clinical hours. If you only work with the AHEC staff, we can definitely work with you on a placement, but we cannot guarantee that it would count for your clinical experience as your program. So the best advice I have is, if you would like to double count, please make sure you're working with both faculty and AHEC staff to assure coordination and maximization of resources. And the reason I say that is you can secure a clinical placement for your program with your faculty, but they might not have good connections on the ground that the AHECs have for things like lodging support, for example. So the best case scenario is always communicate both with faculty and staff, AHEC staff, to make sure that we do the best we can for your experience. I also mentioned core topic areas when I was talking about the didactic online or in-person coursework. We do have to make sure that this coursework that you complete as part of our required hours is specifically linked to these core topic areas that our funders, our federal funders, HRSA, have required. These 5 areas are cultural competency, practice transformation, behavioral health integration with primary care, interprofessional education, and social determinants of health. They also added a current and emerging topics list, which we have generated a list of emerging topics that we would also include for the state of Alaska. Those include chronic disease, geriatrics, substance use disorders, suicide, and trauma-informed care. So cultural competency, any type of an Alaska Native course that you've taken, any type of a training that has to do with the tribal health system, all of those types of things would be allowable. Practice transformation really deals with the means in which we are preparing our future healthcare professionals for the healthcare system, which is transforming before our eyes. So the types of things that we would look at, right, as part of that category could include things like quality improvement efforts, because we're working on quality improvement across the entire healthcare system, working across sectors, so cross-sector collective impact type work is part of practice transformation, among many others that I can't think of off the top of my head right now, but we would be able to look at that category more closely. Behavioral health integration with primary care, it's pretty self-explanatory. There's been a lot of work being done to really prepare primary care professionals to be better equipped to deal with behavioral health problems. Many times that includes having behavioral health professionals on staff in primary care settings, but it also includes making sure that our primary care professionals have more skill sets to be able to deal with and refer patients that are dealing with behavioral health issues to appropriate care. Interprofessional education is getting more and more professionals to work across disciplines together to value and respect each other's roles and understand each other's roles and expertise so that they can rely on each other's expertise in caring for an individual patient. Our AHEC Scholars Program is an interprofessional program, so you will be working on this program with students from other disciplines. You could be placed at a placement site specifically with another student from another discipline to provide you with team-based care. And while you're out doing your community hours, we really want you to pay close attention to the different professions that you encounter throughout those experiences and how those different professionals interact with you in your role as a student. So interprofessional education will be a huge theme throughout the AHEC Scholars Program. Social determinants of health, we all understand that there are a lot of outside factors beyond just a person's physical health that determine whether or not they are a healthy individual. So looking at how we can better assess for social determinants of health, and then how we can provide resources to patients that will help improve all aspects of their life and in turn improve their overall health outcomes. That's another core topic that we'll be looking at throughout the AHEC Scholars Program. And then chronic disease, geriatrics, substance use disorders, suicide, and trauma-informed care, pretty self-explanatory. There is a lot of work being done throughout the state of Alaska on these core topics, which is why we added them to our list. We feel that we have a lot of resources and partners that will be able to provide their expertise on these topics to all of you as future professionals in the state. Another question that I get, so this is interesting. I have already completed some coursework, and I am on the wrong question. Sorry about that. So how can I access eligible online or in-person coursework? I'm one step ahead of myself. So the way that you're going to access these online courses are a couple different ways. The first is you can take a look at our student handbook and see if there are any electives that you've taken in this past academic year that you've started the program that have anything to do with the list. If you have a course that you took that's on the elective list that we have in the student handbook, you want to sign up for that course in advance because we are going to be working with faculty to make sure we have an overview of how many hours that course will count towards our core topic areas, and we will be able to count those electives as part of your didactic requirements. However, we cannot count a course that is a core requirement. If you are required to take a course as part of your program, it cannot count as your required coursework for the AHEC Scholars Program. The other option is using the AHEC Scholars Course Site system. You'll be able to access our online modules, posted trainings, and events. And we will also provide updates on announcements through course sites via email on new opportunities that come available as the course of the year goes by. And this was the question I was going to get at before. What if I've already have trainings completed during my year that I have done in the past? Maybe they're trainings, coursework, maybe it's hours of community experience that I've taken part in, but these hours all occurred before I became an AHEC scholar. Can we count those? The answer to that is yes. What we consider those are transfer hours. In order for us to count them, though, they must be completed within the academic year that they are meant to count for. So if you are an AHEC scholar for the fall 2018 to spring 2019, summer 2019 academic year, then your coursework must be completed within that same academic year. We cannot count any hours that have been completed in a prior year. They have to be completed in the same year that we are discussing. The AHEC program staff must also review the transfer hours for their content and location or population served. So we have to make sure that the hours that you're talking about were completed within a rural location or with an underserved population. We also have to verify and confirm that any transfer hours for content are applicable to the core topic areas, and we will look at that and decide how many hours can count. Sometimes this involves talking with faculty to help determine a stamp of approval from them that the course that we're looking at that's an elective does indeed have a certain amount of hours set for the core topic area. A good example of this is the rural health course for nursing science. There's a nursing science, I think it's 436. It's a rural health care course. I've been able to review with that faculty member that that course does indeed contain 16 hours worth of core content on core topic areas for the AHEC Scholars Program. So completing that rural health course will provide those scholars with 16 required didactic hours. If the things line up that we have to approve and look through, those transfer hours can count, and we just need documentation of completion, which would be uploaded to the course site's website. Program incentives. So what's in it for you? The one thing that we realized right off the bat during our planning year was that students really wanted some form of an incentive to take part in this coursework that was outside of their regular program of study. So fortunately, we were able to apply for and receive additional funding to award students that participate in the AHEC Scholars Program with a $1,000 stipend per year. For someone that's part of the program for 2 years, this would be a total of $2,000. As I said, it's a minimum of 2 years. You could be accepted into the program more than 2 years, and you would be eligible for a $1,000 stipend for each year you participate. We also secured funding for travel reimbursement to rural sites. What that looks like for you would be you would book your own airfare, mileage, or ferry. You would be required to do cost comparisons and save receipts for all of this travel in order to be in compliance with our federal grant funds. We had outlines within the course sites of what exactly that looks like and how to apply for reimbursement. And then once you complete your rotation and all your required hours, you would be able to receive that reimbursement. In addition, we have support for lodging, but the lodging support would only be for up to 40 hours in a rural or underserved community. If it's in your hometown that you're going to participate in this, we do not cover any lodging expenses or travel expenses. However, if you do have to travel to another community to complete your hours, we would only be able to reimburse up to 40 hours of lodging. What that means for you, if you go on a 6-week rotation, for example, we wouldn't be able to provide lodging funding for the full 6 weeks, but we would be able to provide you support for up to 1 week of your time. Another benefit that you get as being part of the program is employer connections. When you're out there working with those communities, working with those programs, you do obtain a lot of connections to employers, which can be extremely beneficial to you in your job search once you graduate from your program of study. I think that the best way you can look at some of these experiences is as an informal job interview. You're basically showing them what you're made of and paving the way for a potential future job position that might be opening for you in the future. So keep that in mind. It's obviously a great resume building experience for you. It's a unique program. It is something going on nationally, so it is part of a national program, which is pretty exciting. And then, of course, professional development. You have access to a lot of didactic materials and trainings that the average student might not have access to. We understand that there's a lot of changes going on in the healthcare system, and a lot of our stakeholders, our industry partners, are telling us students get out of programs, they get into the positions that they're working for as a professional, and they're not really equipped for all of the changes that are going on in the healthcare field. So we hope that this will be an opportunity for you to get an edge, a head start on some of the things that your employers are going to be looking for you to understand before you get there. In order for you to access some of those courses that do have registration fees attached, we have some support available in our office. We might not be able to cover the full cost of participating in some of those experiences, but we do have support of up to $100 per year for registration fees for that outside coursework. I have the little asterisk there because it's not necessarily only $100. On a case-by-case basis, and depending on funding availability, we can review whether or not we have more funds available to cover a higher registration fee. So keep that in mind. That's another way for you to earn your didactic hours. In terms of the program logistics, we will provide assistance with securing housing and placement with preceptors. Like I had mentioned before, if you want it to count for your clinicals, we need to also work very closely with your clinical faculty, your faculty from your program. We also provide that travel support, and it is on a reimbursement basis. We will not reimburse until your requirements are fulfilled for the program. In addition, we decided that it would be best to distribute our stipends in multiple payments. So since it's a 2-year program, at minimum, you would receive 4 payments of $500 each, and those payments would be dependent upon completing your program requirements. So the first payment would be distributed to you at the beginning when you become a scholar as a front-end help to provide you with some support, to have some funds to get you out and started on your participation in those rural, especially those rural sites. The second $500 disbursement for the year would be distributed upon completion of your requirements, of all your required hours. I did want to make a note that University of Alaska students, the only way we could distribute stipends to you all will be through your student account deposit, which means if you do have a balance on your student account, your funding would go towards that balance before it would be accessible for you to pull out. So you want to make sure you keep that in mind, because if you do have an active balance, the funds that we distribute to your account will go towards that balance. For non-UA students, we do not have that same issue. We would be issuing a check to any non-UA students that are participating in the program. When I say UA, I mean the entire University of Alaska system, so Southeast, Fairbanks, and Anchorage, and all satellite campuses. And for non-UA students, I'm talking about APU, Charter College, and Illisagvik College. Evaluation and follow-up. So for every program to be successful, we really have to look at what we're doing and make sure that we are listening to our participants, constantly on a cycle of improvement, trying to get ourselves better and trying to improve our outcomes. So I did want to make sure that all of you are aware that our Scholars program does involve an evaluation, and that evaluation must be completed in addition to your requirements for your hours in order for us to disperse your final annual stipend. We also wanted to let you know that following completion of the 2-year program, the AHEC program will remain in contact with you for follow-up at a minimum of at least 1 year following your graduation. And the goal of that is to really find out where you are, where you're practicing, what you're doing, so that we can be better informed of whether or not our program is successful in meeting our goal of providing more rural providers throughout the state and providers in underserved communities working with underserved populations. As always, I wanted to make sure you have a contact point in case you have any questions or concerns. I went over a lot of troubleshooting here, but as always, if you need to reach out to us, the best way to contact someone in the AHEC program would be to connect with myself, Gloria Burnett, the AHEC program director. My contact information is there, email and phone. And then also Dave Berry, our AHEC education coordinator. He will be the man in charge of helping with all of the placement logistics and support. And he's also our course sites guru, so if you're having any types of trouble with our course site system, he would be the one to connect with regarding those types of issues with the technology. In addition, the student handbook that we've put together is available on our website and also on the course sites. It has a bunch of support questions, resources. Please take a good look at it. It is definitely your first point of contact for questions you might have. We've done a really good job. Dave has done a very good job putting it together. It's very comprehensive, and it is a great resource for you, especially when preparing to go to your rural communities. I'll also let you know that in addition to this orientation, there will be a kickoff annually in the fall for the AHEC Scholars Program, where we will bring all of our participants together to kind of celebrate and launch the program. And we will also be working individually with students to talk to them about where they plan or are interested in becoming placed, and making sure that we are placing students in the appropriate communities that are most aligned with their interests and their expectations. So that's all what's yet to come. Again, thank you so much and congratulations for being part of our AHEC Scholars Program. We look forward to working with you, and we wish you the best of luck. Thank you.